Namaste. This is Ruben Vasquez with rubenvasquez.com, and this yoga posture session is for releasing lower back pain, tightness in the hip joints and the hamstrings. It is an excellent practice for the beginning of the day to release general stiffness. It is also a very good practice after walking, hiking, running, jogging, riding a bicycle. It is also excellent at the end of the day to give your legs and your lower back a nice, well-deserved rest. It is very good as preparation for going to sleep. Please remember, there is always a clear intention in your mind and your heart for your practice. There is no forcing, no strain, no pain, no tingling or numbness. All those are signs that we may be trying too hard. We don't amplify existing pain. If anything, any existing pain will dissolve or release or soften at the edges. Instead, we focus our energy on our intention and breathing to our full capacity without any strain or forcing, allowing the breath to guide our actions. Enjoy this practice. Start sitting with one side of your pelvis against the wall, recline back, and then reach up with your legs along the wall and lower your torso to the floor. Take a moment to relax, maybe close your eyes, deepen your breath. Reach up and back with your arms and notice the effect of this action along your spine. Maybe there is a little lengthening, more space between your vertebrae perhaps. Then allow your arms to come into a position that is relaxing, that helps to create space around your shoulders and around your neck. Keep breathing deeply and start reaching up and away from the wall with that right leg. Try to keep the legs straight. Try to keep the right side of your pelvis pressing on the floor if that works for you. And remember that you stretch as far as feels right. There is a nice intensity in the lengthening action, but never strain or pain. Front of the right leg is active, as if you were trying to bend that right knee but not bending it. Then return the right heel towards the wall, and let's try the other side. Left leg now. Here you're paying attention to the sensations. There is no forcing, face relaxed. And compare the sides. If one side is clearly tighter than the other side, then you may want to stay longer on the side that is tighter, or repeat the side that is tighter. Return that left heel to the wall. Take a moment, breathe deeply. When you feel ready, bend that right knee, cross the right leg over the left leg, point the right toes towards the floor, and maybe use the left hand to help the right foot move down closer to the floor on the left side of your pelvis. Stay relaxed. Try to align the right knee over the left knee, and then start bending that left thigh towards your chest. Here I'm just showing what might be possible. Remember that you're paying attention in your body and noticing where your body says, this stretch is enough. The intensity here is just appropriate for me. Never going into pain. Slide the left leg up and stretch the right leg up. Then, when you are ready, bend the left knee, cross the left leg over the right, point the left toes over towards the floor. Maybe the right hand helps. Try to align the left knee above the right knee. This may or may not be happening today. That's okay. Stay with the sensations, deep, peaceful breath. Slide that right heel down the wall, bringing the thighs closer to your chest. Here again, we want to make sure that we are going to stay a little longer on the side that is tighter. If there is no difference, then give equal intensity and stay equal amount of time on each side. Breathing deeply as you inhale, release, and reach up with your heels. Take a moment. Long spine. Make sure there is no discomfort anywhere. Bend the right knee and bring the outer right ankle to rest at the front of the left thigh where it meets the knee. Open the right knee out to the side, relax that right leg, and slide that left leg down, bending the left thigh towards your chest. You can emphasize the stretch with your arms back, lengthening along your spine. Observe the sensations. The lower back may lift off the floor, depending on how tight you may be. Try to relax at the lower back. Again, paying close attention to sensations, adjusting so that the intensity is appropriate. Stretch the left leg up, right leg up. Take a moment, deep breath. As you're ready, bend the left knee, outer left ankle at the front of the right thigh where it meets the right knee. Open the left knee out to the side, relax that left leg. Bend the right thigh towards your chest, sliding that right heel down. And here, give the intensity that is appropriate. No expectation, just feeling what is happening. So here again, we want to compare the two sides. If this side is tighter, stay longer, or give it a little more intensity without numbness, tingling, strain, or pain. Listen to your breath and notice how your body is reacting to this. You're trying to think, I should feel this here or there. Then stretch your legs up, lengthen, relax the lower back. Bend the knees, bring the thighs towards your chest, hands to your shin bones, press your feet against the wall. And try to relax in the lower back. Notice how this feels. Observing sensations, relaxing in the lower back, keeping the spine long, soles of the feet together, open the knees away from one another. Try to make sure there is equal weight on both sides of your pelvis and the same distance from each leg to the wall. You're trying to create a balance. As you're using your hands to maybe help the thighs, make sure that you're not creating tension in the shoulders. Then bring the thighs together and slide a little bit away from the wall. Roll to the left side and bring the sole of your right foot to the floor, outer edge of the right foot against the front of the left thigh. Open that right arm up and over to the right, and the left hand helps the right thigh, right knee come closer to the floor. Of course, there is no forcing. Turn the head towards the other side and then try to guide that right knee away from the floor. Deep, easeful breath. As you are ready, release, thighs together, feet to the floor. Take a moment. And let's try the other side. Roll to your right side. Bring the sole of the left foot to the floor, outer edge of the left foot against the front of the right thigh. Reach out to the left with your left arm. Roll the head to the left if that works for you. Right hand can bring the left thigh down if this doesn't create pain. And then try gently guiding that left knee away from you. Easeful breath. Observing sensations. Notice what is happening. Staying longer on the side that needs more attention, more lengthening. Come back to center. Open the arms to the sides. Observe the sensations and then drop your thighs to the right. Maybe rolling the head to the left. Come back to center and exhaling again, thighs to the other side. A couple of times to each side. Maybe rolling the head in the opposite direction. Then roll all the way to your right side, thighs close to the chest, inhaling left arm up and reach back. Maybe even rolling the head towards the left side, as long as that doesn't bother your neck. If it agrees with you, you can stretch that left leg out and notice what is happening. Where are you feeling the sensations as you are doing this? When you are ready, release, come back to center. From here, drop your thighs to your left, keep the shoulder blades on the floor, come back to center and over to the right, maybe rolling the head in the opposite direction, and again to the left, and thighs through center to the right, realigning your spine, coming back to center, and one more time, thighs to the left. Bring the thighs close to your chest, inhaling right arm up and back. Maybe left hand helps to make the right thigh a little heavier. Roll the head towards the right if that works for you. Easeful breath. Optional, you can stretch that right leg out. Notice sensations. Easeful breath. Sensation of release on the exhalations, and don't forget 100% inhalation and exhalation every time. Release, come back to center, and once again twisting, dropping thighs to the right, then through center to the left, a couple more times, making sure that your spine feels comfortable, realigned. Now roll onto the floor, knees bent. Relax your arms, spacious chest. Head aligned with the rest of the spine, maybe sliding the shoulder blades towards your pelvis. Taking a moment, enjoying the effects of this short practice. This is a very effective practice, but of course, patient persistence is the key to this. Patient persistence with deep breath and clear intention, awareness of what you're doing. I hope that by practicing these, you can get out of pain, out of limitation in the pelvic area, and regain the health in your lower back. Thank you. Namaste.